Hey everyone, welcome back to the Agenda Now channel. Today I'm breaking down a Capitol Hill hearing that could change the game for healthcare everywhere, how Alabama is tackling the nationwide nursing shortage, and why Senator Tommy Tuberville thinks their approach is so unique. Let's jump right in. Senator Tuberville, you might know him as the former football coach, kicks things off with a big warning. America's nursing shortage isn't just a healthcare problem, it's a national security risk. And that's when he puts the spotlight on Alabama's bold new solution, a statewide nurse apprenticeship program that's turning heads across the country. The mastermind behind this program, Mr. Laney, steps up to explain how they did it. Here's the trick. Instead of guessing what hospitals needed, they actually asked them, "What skills do you want? What gaps are you seeing?" They built the apprenticeship model around those real answers. But here's where Alabama gets clever. The Board of Nursing created a special nurse apprentice license. This license spells out exactly what apprentices can and can't do. That clarity is a total game changer because it gives hospitals confidence to hire and train apprentices safely. No gray areas, no confusion. And the results? They speak for themselves. Alabama now has over 1,000 nurse apprentices, 87 employers, and 28 colleges and universities all working together. That's a full statewide network, and it's the only model like this in the country right now. But get this, every employer is all in. They've set up a last dollar scholarship system. What does that mean? Apprentices don't end up with debt. After grants and aid, like the GI Bill, employers cover any leftover costs. So these future nurses graduate owing nothing, and hospitals get loyal, well-trained staff. It's a win-win. Next, Senator Tuberville asks Dr. McCain a key question. How can the federal government help expand these programs? Her answer is simple. Community colleges need connectors, intermediaries who link them with local businesses. Most small companies don't have the resources to build training programs from scratch, but with the right support, community colleges can step in and fill the gap. And then, Mr. Carrick explains why not every employer signs up for federally registered apprenticeships. Too much paperwork, not enough payoff. In some states, like North Carolina, the government gives strong incentives and keeps things simple, but at the federal level, it's just too much red tape. So, here's my big takeaway. Alabama's model works because it's a true partnership, education, business, and government, all moving in the same direction. It's fighting the nursing crisis, creating jobs, and offering a debt-free path to a great career. If other states follow this lead, we could see a whole new way of building America's healthcare workforce. If you found this breakdown helpful, hit that like button, subscribe for more deep dives, and let me know in the comments what state should try this next. Thanks for watching Agenda Now, and I'll see you next time.
Mr. Booker, I will defer to Senator or to Coach Tuberville.
Thank you. Thank you, Mr. Chairman. Good morning, everybody. What an important hearing this is. Morning, Mr. Laney. How are you doing?
Is your microphone on, Coach?
Pardon?
Is your microphone on?
Yes, sir, it is.
Maybe we'll pull a little closer.
Can you hear it now? I was getting too comfortable here. Mr. Laney, your apprenticeship program for nurses in Alabama is uniquely successful, and we're in national security risk now with our nurses being a shortage. How come it's so unique?
Thank you for the question. I think the program in Alabama is unique mainly because it was built starting with the needs of the employers. We spoke with our Alabama Hospital Association, Alabama Nursing Home Association. They were the ones that were driving this because they are the ones that are feeling that pinch. They just don't have enough people at the bedside to provide the service that they want to provide. They went and worked directly with our Alabama Community College System and our Alabama Board of Nursing. I have found that our Board of Nursing, I didn't know at the time, but is much more progressive in their thought than a lot of the ones across the country. And our Board of Nursing created a nurse apprentice license that designates the scope of practice for that person so that you don't have confusion about what is this person allowed to do or not do on the job. And because it was designed that way, employers are comfortable putting these people to work, and they get a return on the investment that they're making. We always say that apprenticeship is an employer's investment in their people, and you don't get a return on investment you don't make. So the employers are seeing that investment, they're seeing the value add to that, and they are taking it up very quickly. So we have the only statewide model now with over 1,000 nursing apprentices, 87 employers, 28 colleges and universities.
Most employers have skin in the game?
Yes, sir. Every employer in Alabama has skin in the game. We have what we call a last dollar scholarship policy. So we do not allow an apprentice to incur any debt for going through the training. If there's a bill left over after things like GI Bill or WEO or a Pell or whatever gift aid we can find, we call that coupon hunting. We try to bring the price down as much as we can. But if there's a bill left over, it goes to the employers. And at first, we were kind of worried that they would balk at that, but they absolutely have not. They see the value in it, they pick it up, and they've run with it.
Thank you. Dr. McCain, glad you're here. Could you tell us about what we can do from the federal level to help with the community college system apprenticeships?
Absolutely. I think one of the things that we need within community colleges, intermediaries, to be able to go out and bring the businesses where they're able to work with the community colleges. A lot of times the community colleges don't have the bandwidth to be able to reach out to businesses. They have workforce development departments. They have people that are working in workforce development. But how do we ensure that what the small businesses need, especially around related technical instruction? A lot of your businesses don't know what related technical instruction looks like. They don't know they know what on-the-job training looks like, but how can we get more of the infrastructure around community colleges? And that's done through giving them those intermediaries to work with them.
Thank you. Mr. Carrick, you mentioned that in your testimony, 15% of the FAME students participate in registered apprenticeships. Can you speak on why employers choose not to register for the program?
Sure. So when you look at the registered apprenticeship model, it is designed with a lot of compliance elements to it. Manufacturers are able to design a program like FAME where they can work directly with the community colleges, they can recruit students, they can train them how they need, allow them to earn an associate degree, pay them along the way, and set them up to be global best entry-level multi-skilled maintenance technicians. And we don't need the registered apprenticeship system in order to do that. Now, in some cases, in some states, the balance between cost and benefit falls in favor of registering the program. North Carolina is probably the best example of this, where the state offers a number of incentives that in the minds or in the evaluation of the employers that lead the program, they decide that participating in registered apprenticeship made sense in that case. So it's really an evaluation of the balance between the costs and the benefits. Unfortunately, at the federal level, that balance tends to be a little bit out of whack.
Thank you. Thank you, Mr. Chairman.